Thank you very much, Vamsi Garu. It's nice to be with all of the people that we are interested to educate. But it's also a situation where we are doing this in a situation where we are all pressurized for time as well as knowledge and resources. So let us see how best we can use it. And thank you very much for your nice introduction. You take care of the admit business. I will not put my eye on that. COVID 19, we are going to look at some essential basic knowledge. Means what? We are not going to talk something which is high profile, what is done in the ICU, what sort of people are given NIVs and different types. That is not the point. The common man, what we should be knowing about the disease and how best we can survive without being affected by it in a serious way, and also how best we can protect ourselves in not getting affected. We see hundreds of people, our relations, coming with messages that they have been infected or they are worried and things like that. Some of the basic worries and mental anxiety should be clear at the end of this session. That is the main objective of this. Remember that this presentation is updated till today, and this is to allay fear and prepare ourselves for action. There is a mobile number of mine here, which you all can see, and this mobile number you can use to communicate with me for any need. I am open 24/7. Please use me and don't call. Just give a message, I'll get back to you. And there is a website also where this talk and several other COVID talks also will be available. So with this brief knowledge about what we are going to do, let's go further. So we are going to talk it over in this pattern. This is called the floor plan of the talk. The virus, the burden of illness, the transmission, prevention, what symptoms, how to trace the patient, and what is our preparedness for that, what treatment, briefly, not extensively, what exercises I do, what are certain myths and facts, and how to be hopeful. Finally, we end up with a sutra called the Saptapadi. What is that? We will see. Okay, look here. This is a beautiful looking pictorial representation of the coronavirus. Looks very smart and very intriguing, but you can see there are certain projections around that. These are the ones which produce problem. For example, you see this is what is called a spike glycoprotein, and that is the one which it uses to drill itself into our nose cells and the lung cells and cause all the damage. The vaccine that is prepared is also against these spike proteins. There are other proteins here which are also important for the virus to do the damage, but vaccine does not contain any of these. So you can be rest assured that not the entire virus is there in the body when you are vaccinated. Only the spike proteins which are used like a screwdriver to drill itself into the sort of the body tissues like lungs or the nose are the ones which are targeted for the vaccine, and that is the protein or the spike that it uses to get into the body. So its good name, may I know your good name? Yes, its name is SARS-CoV-2. It's called SARS-CoV-2. What is the disease it causes? COVID-19. Don't get confused. The disease name is COVID-19. The virus name is SARS-CoV-2. So you have to understand two words, quarantine and isolation. This I'm not going to deal very much because I don't want to focus on the fatalities and negativities of life. They do occur when such a havoc is being caused, and that is a part of the story. We are the children of 130 crore population mother, and naturally some calamity here and there is bound to be there. So what is quarantine? Quarantine is separation of group of people or individual person from the rest when he has got an exposure, or that means when he contracted somebody with COVID but still does not have the disease. He is not a diseased patient, neither he has any symptoms. He has only got a sort of exposure to the virus by contact. Such a person, when he is separated, it is called quarantine. Isolation is somebody is shown positive either in the CT scan or in the RT-PCR, who is symptomatic, who is the proved case. If that is the case, then you keep him very much separate, and that is called isolation. Why this distinction? The rigor here is much less compared to to the rigor here. These are important websites. I'm going to share the presentation with the Art of Living group. They can pass it on to the group. If you want to know some information, don't go to WhatsApp, don't ask your friend, don't browse here and there, don't go to net and see all sorts of things. Don't look at the other unnecessary, unfiltered videos, but you can go to standards right like ICMR, Ministry of Health, WHO, COVID-19 WHO, Worldometers, Medscape, and these are some of the important websites which provide authentic, at the same time up-to-date information which is not misleading and which is as per the international norms and guidelines as on date. For example, Ministry of Health has updated the guidelines of treatment on 22nd April, and yesterday night one more update has come. That is the way they are being updated. Don't fall prey to any messages which appear in the social media, in the TV, in the YouTube, WhatsApp, mail, messages, particularly newspapers. Don't look at that information. If you want any information, look at the standard sites. That is the way we will do it. Supposing you want to buy a good necklace, will I go to a standard shop or a petty shop in the next door and buy it? Same way here also, right? Now you need to understand two important things. This is a patient who is already having SARS-CoV-2 or an infected host. This person is an infected host and he can transmit the disease to the susceptible host. Means he is not yet having disease, and this transmission can occur as a droplet or as an aerosol. Lot of debate. Is it aerosol, is it droplet? Does not matter. Both mean the same. Only difference I'll tell you in a short while. If the particle size is more than 5 microns and it drops onto the ground and it cannot travel more than 6 feet. Suppose the particles are very finer, less than 5 microns, then naturally it can travel longer distances and 6 feet distance may not be adequate. So that is the only difference. Aerosols are dangerous in closed spaces. What are closed spaces? Like malls, cinema theaters, auditoria, or AC rooms, big halls and function halls. The aerosol will be causing problem because it is spread all over, and even if you keep the distance, you still have a chance of getting it. Otherwise, in open place, droplet infection can be transmitted only within a distance of 6 feet, and better you avoid such nearer distances. Don't be very intimate to anyone. And you require to know one more word which is called fomites. What are fomites? Fomites are, this is a fomite and this is a fomite, and my mouse and my mobile phone is a fomite. Any object which can transmit the virus, any non-living object which is like your tabletop, kitchen top, sofa handles, all these are fomites. The commonest fomite is of course the mobile phone. So keep cleaning the areas where we commonly touch, the mobile phone, the laptop, the pens and all the things. So that's all about the aerosol and droplet. Remember, droplets cannot travel beyond 6 feet. And if you keep that distance, you are very safe. Aerosol can travel larger distances, but in a closed room. In an open air, if suppose I go into the park, no aerosol business. If I open the window, corona will not come inside because aerosols are very dilute in an open environment and they will not do any harm. Okay. Now, stop the spread of the disease. How do you do that? We always have a very bad habit of coughing. I will put like this, like that. I will try to blow on the other person. That is our habit of coughing. Never do that. The best way to cough is into a tissue and then dispose of the tissue. Or otherwise, you keep a sort of kerchief or something and then cough into that and later on change the kerchief. Supposing I don't have anything in the hand, into the left elbow. Why? This is the least touched part of my clothing, and the clothing can be changed immediately after a few hours. So the cough etiquette, it is called, very important. Never cough into the palms like this and then you touch every object and it is transmitted. Never cough into your palms. If it is urgent, you have to completely close and wash your hands immediately. So what I will do, I will not cough openly without covering. I will not use this speaker mode of coughing. I will not do this in the coughing mode of into my palm. If it happens so, I will clean my hands immediately with soap and water. Cough and sneeze means the same. And better use a tissue disposable or a kerchief, clean kerchief, which is frequently changed. Okay. And then if I don't have anything, if my sneeze or cough will suddenly come, my elbow is at my rescue. This is the way I have to keep. And that is you educate your children. This is the way we have to protect from all respiratory infections. This is called cough etiquette. Okay. Now avoid touching your eyes and nose and mouth. There is no business to touch the nose, prick the nose, put your hand in the eyes and all that, and also touch the mouth and then clean the lips with the hand and all that. The moment we wash our face and get ready and makeup is over, until the next time we visit the washroom, there is no business. The hand should come in contact with the mouth. This is called hand mouth contact, hand nose contact. If you avoid, 95% of the infections from the fomites can be completely controlled. Never use others' mobile phone, others' pen, and you use your own pen. If you have to sign, take your pen and sign. That way the fomite transmission can be avoided. And the most important thing is wash the hands. How do I wash the hands? First, soap yourself, put a little bit of moisture on your hand, soap them very well, and also the interspaces also like this. And this is the way you have to soap it completely on the back, and you rub your hand like this with the palm, and this is ready. And not immediately wash, because soap contact time of 20 seconds minimum, preferably 30 seconds is required to get the virus completely sort of destroyed by the soap. Soap has got two ends. One end is where joins with the water that we sprinkle on the hand. The other end joins with the fatty layer of the virus and pulls the virus fatty layer apart and instantaneously inactivate. Such a virus which is causing havoc is just amenable for 20 seconds of soap and water. Remember how good is to keep the hand hygiene, and when you wash the hands after 20 seconds you are safe. How do I ensure 20 seconds? Do I have a watch? Not required. You say happy birthday song 2 times. Happy birthday to arts of living. Happy birthday to arts of living. Like that, whatever you wanted to say for 2-3 times you say. 20 seconds are over. This is the way I ask you and advise you and expect you to wash the hand. By this, what will happen? You will not be transmitting this virus to others or neither to yourself from the hand touch. Okay. Now, these are the hand washing techniques. The first one is the soap the hand. Then is you have rubbed all the parts, interspaces you rubbed, back of the hand, the thumbs, then the palms and the wrist also. Wait for 20 seconds and then wash. When do I wash? Before every meal and of course after the meal. Whenever I cough and sneeze, whenever I use the toilet. This is generally not applicable to many of us. Now we are not playing with pets or the ball games or anything. So at least if these 3 you do, what will happen? At least I use the food for 3 times and I use the sort of toilet at least 4-5 times for urine as well as stools. Total 8 times. 8 times I wash in a day, and each time you use 20 seconds, and I'm awake for 16 hours. That means every 2 hours I am washing, which is more than good enough. More than good enough. Remember, we forget to wash. What we will do? We will just put little. That's it. That to half a hand or only the tips of the finger. Never do that. Washing has a purpose, and the purpose should be served. And the heart, the whole process is a farce and it will be defeated. Please understand that. Okay. Now I will show you a little bit of information on the. So this is again the sanitizer. Supposing I don't have water and soap in access, I use a sanitizer. Sanitizers are 2 types. One is the liquid sanitizer, which is green color or red color or yellow color or whatever is the color, a blue color. That is a sort of very liquid one. The little bit semi-solid or semi-liquid one. And whatever you use does not matter either 1A or 1B. But you take it enough quantity, rub thoroughly into your hands, both the hands, insides in the in between the fingers, and then interlock the fingers, and also just do like this interlocking, and then putting the sanitizer like that, and also like this, the fist, closed fist, rubbing each other. And then of course don't forget your thumb, because without touching the thumb you cannot touch any object. If you want to touch an object, thumb plus other fingers only. That's why thumb is the most contaminated along with the other fingers. Then of course rub the sanitizer onto the palm of the hand also like that, and then allow it to dry. Because if you don't allow it to dry, this contains alcohol, and unnecessary hazard with the alcohol. You may directly, inadvertently touch nose or eyes, and it will burn. And somebody asked whether it can, cause some fire accidents. Unfortunately, it cannot cause fire accidents unless you take alcohol and go onto the fire. That's not a problem, but then just, expose it to the air for about few seconds, and that will happen to dry. How much time I should spend? Again, half a minute, 30 seconds I have to spend time on that. Okay. And now, avoid close contact with people who are sick. Somebody in the family is having fever or symptoms of corona. Try and keep them in a separate room and avoid close contact. All these things are not my slides. These are all borrowed from Communicable Diseases Control Center, an internationally reputed CDC slides or WHO slides or ICMR slides. So these are all standardized and vetted by experts. You have to just take them and use them as they are. Okay. Clean and disinfect frequently touched surfaces. I already told you the commonest things that can transmit the disease are the mobile phones, the laptops, door handles. Entire door, don't go on wiping the door. Nobody touches the door. Only the handle is important. Don't clean all the almirahs now in corona time, not required. Only the areas where you are using, those are the ones you spend time. Kitchen daises, tabletops, and then all the supplies that come in. We have to spend a little time on the supplies. I will do that. Okay, stay at home when you are sick, and then get medical care at home. Home is the best place to recover. As I told you, home isolation is the watchword in this pandemic. Don't think of hospitals straight away. Hospitals are only expected for people who are, who are sick enough to go to the hospital. 95% of the people can be cured in the home itself. Then again, regarding wearing the mask, we see different people wearing masks in a different fashion. One puts to the chin, one puts to the mouth, one puts to the neck, one puts to the ear, one puts like a bag on the hand, one puts, elsewhere, any part of the body, including the private parts probably, and not on the face and mouth. Remember, face and mouth are the private parts. Will we go into the public without covering our private parts? Just answer that question. If any one of us can dare to go into the public without covering the private parts, ladies and gents, then you can do without covering the face and mouth with the mask. That is the importance. Today, mouth and face are the private parts and properly covered. Properly covered means this slide demonstrates how to wear the mask. Not going to go into the details anyway, the presentation will be with you. This is the WHO slide. And again, do nots. So do not hang it like that, or do not wear it on the very loosely or below the nose, or whatever way we have just now described. Okay, now how to wear a medical mask? This also I'm skipping because for want of time. Anyway, these are there. I'm going to show you that mask. Of course, this is what is called a medical mask. A medical mask will be green on one side and white on the other side. It comes in a pouch. When you want to use it, open it, and then there are the ties to tie the knots onto the back of your head. This is the commonly used protective mask when you don't have corona positivity or when you don't have symptoms. You don't have to go to very sophisticated masks. This is good enough for all of us to protect ourselves. And the second type of mask is a cloth mask, which can be made at home or ready-made things are purchased. There's a little nose clip here. It clips the nose and it has got the things to this one. Always never touch this part of the mask. Hold it with the end and then put it like that and adjust it. And once you have worn, you have no business to touch the outer side of the mask, because this is the one which catches all the viruses and it will be there on this. If you touch your hand on this, it's good as touching the virus. So don't do that. This is the second type of mask. This is useful only for people who are not infected, who are not having the corona positivity, do not have symptoms. Somebody has symptoms and also corona positive, you have to use what is called N95 mask. It is available in white color and also in yellow color, and this is inside, it has got a padding and it has got a 3-4 layers of filter. 95% of the virus is filtered. This is worn by whom? By the person who is affected with corona, with positive, either in the CT scan or in the RT-PCR, and also the person who is symptomatic of corona, and not the others. Supposing I am going into the room where a corona patient is there, then I need to wear this mask. Outside his room, I need to wear this mask as well as this mask. Supposing 3-4 people in the house are affected, use this mask and use a double mask. You cover the second one. First you use this one, on top of that you use the double mask. That also is possible. But never use a double mask with this. You will not be able to breathe. Breathing will be difficult. It is already having 4-5 layers, and no double masking of the N95 mask, please. Okay. And now there is no panic. Don't buy panic buying, and then keep supplies enough for others also. They will be made available. As far as possible, do not go out. And here the question is not as far as possible, for the next 1 month to come, arrest yourself in your home. This is the word I use. Arrest yourself in home or lock out yourself. Don't call it as a negative arrest. It is a positive time to spend with the family. See old albums, look into the different pictures that you had, and then cherish the memories, hear music, and prepare good food, and then eat, and then spend time, play games, particularly with children, and this is the time to spend with family. And then use fabric mask, not N95. Social distancing 2 meters. Carry hand sanitizer and tissues. Cough etiquette. Do not spit. This is a beautiful habit we all have in our country. Indiscriminate urination, indiscriminate spitting, indiscriminate defecation also, which is the reason for many diseases. Avoid to visit any hospital unless you really have need to go. Avoid crowded places. As I told you, crowded places have the aerosols like malls and then cinema halls, this one, the function halls, and postpone all functions. Everything can wait. Corona is so emergent now, everything can wait. All my ear boring, head shaving, and then Gruha Pravesa, Upanayana, and all sorts of petty, big, small, all functions, religious melas, this one, Satkaras, Sanmanas, everything can wait. Never enter into that area. Clean all purchased items with soap and water. What do? I clean all the things with soap and salt water. That means, perishables like vegetables, fruits, and any other things which are to be washed with water can be washed. Immerse them for about 5-10 minutes in warm salt water, then rinse. Nothing will happen. Okay, and then this is warm salt water, and other things you sanitize with the sanitizers. Preferably leave them for a day without touching. On the second day, open the wrapper and throw the wrapper carefully. Wash your hands, pick up the stuff from inside and sanitize it and use it. And wash hands. Preferably take bath after receiving supplies in large supply, and try to ask for 5 days or 6 days, and don't try to sort of buy every day, and avoid people coming to you. Okay, so 1 meter, 2 meters distance now, and these may look very simple. Whatever I told you, too repetitive, and but absence of specific treatment, we have to use these control measures. And second thing is vaccination is available, but not available for all readily. It will take a few days for everybody to get vaccinated. And very important, to stay ourselves uninfected, to keep our near and dear safe, to delay transmission, to win the war. Here in Corona, I can't win unless everybody wins. The dictum is the Corona war is won only with everybody wins. Single person cannot win. It is our social responsibility. Remember that. Care on the packets and supplies we have already discussed. So whom to test, that is very important. ICMR has yesterday also revised the guidelines, and there are 2 types of tests. One is called the RT-PCR, the other is called the point of care test, also called the rapid test, rapid antigen test. Never do antibody test. Never do, even after vaccination, before vaccination, after infection. No role for antibody test at all. It's only for research purpose. So only two tests are available. The RT-PCR test, which is the most powerful one, takes a little time, maybe one day or a little more, and RAT test, which will be positive in 15 minutes time. So it will be positive or negative, we know, and these may take a little 24-hour time. This is around 30 minutes maximum, rapid antigen test, also called the rapid test. Consider positive until the result comes. I have symptoms, let us say somebody has symptoms and his test is not given or given until it is positive, you presume that a person is having infection. So, and know about your nearby labs, test centers. This is very important for you to know. What is this? Incubation period means what? So days of infection from the symptoms of onset. This is the first day fever or cough or sore throat, and their maximum infective in the 7 days, and after 14 days almost non-infectious. How to count it? Not from the day of test, from the day of symptoms. The day of first symptom or malaise, weakness, cough, fever, whatever it is, that is day 0. 7 days, the maximum infectivity occurs during the first week. Second week also infective. And the incubation period is the time during which you are not having symptoms but have the virus. That is before this. How long is that? It's another 1 week here. But once the symptoms are there, it is around 1 week times the maximum infectivity, and the remaining for 2 weeks is the time period by which we can say a person is non-infectious. So no symptoms and healthy. Asymptomatic means only test is positive, does not have any symptoms. This is a healthy person, no symptoms, no test positivity. Second one is test positive but asymptomatic. Third one is pre-symptomatic. That means he had symptoms but they're waiting for the report. Report is not yet given or they are not yet tested. ILI is mild illness, influenza-like illness is called the ILI, and then you have the lung COVID. This you can call as nose COVID or the throat COVID. That is the ILI. Infection in the lungs is called pneumonia or the lungs COVID. And then the severe illness is complicated illness. Not many people will go into that. And fatal illness is dangerously ill or DIL. So these are the categories. Healthy individual, no symptom, test negative, healthy. Asymptomatic, no COVID test positive. Pre-symptomatic, waiting for the test. ILI, mild illness, and then pneumonia is your lung COVID, and then serious illness, severe illness are very rare. Now, so fever, cough, and shortness of breath. What are the watchwords? Three important things: fever, cough, and shortness of breath. How do I know I am short of breath? Anybody is there? Ask him to count 1 to 20 and without a break, or talk to him, or ask him to read a small passage of 4 lines. If you're not able to do without taking, becoming breathless, then that is breathless. Or not able to walk from one room to another, not able to put on the dress, not able to do the combing by themselves, simple activities causing shortness of breath. Now, what are the symptoms? Common thing, the symptoms are here. This is called the upper respiratory, that is nose, throat, and the mouth. Congestion, runny nose, loss of taste or smell is as powerful to predict as an RT-PCR test. What is that? If somebody has got loss of taste or smell, very predictive of the disease, as though it is a test. What do I smell? Not camphor, karam, or masala powder, but take little coffee powder, put it in a little tin and close it, and then try smell it. Or agarbatti, not the lighted agarbatti, a simple agarbatti also can be used to test the smell. Of course, taste, anybody can be, usually they will tell you when the taste is disturbed, and the patients are saying that they have jaggery like taste or a sticky like taste. Then if it is going down, then it will slowly enter into the lungs and the throat, cough and sore throat. And headache is a feature. Fatigue, muscle pains, body pains, fever of up to 100, 100.5 up to okay. But continuous fever of more than 1 degree is again not a good sign. And shortness of breath, nausea and vomiting, and many people are presenting with loose motions also. These are the common symptoms. Up to here, it is milder disease. Once it enters the lung, it is called pneumonia or the COVID pneumonia, which is going to spread into the body and blood vessels and produce problems. Okay, now understand this table very clearly. What is the definite case? What is the probable case? What is the suspect case? So a person has got a contact with COVID patient and he has got symptoms of COVID as described earlier and his test is positive. What test? RT-PCR or the short simple test, and then the action is what I have to do? Isolate the patient and then treat the patient with the first line of treatment. This also I will share you what will be the treatment for the mild disease. Then the second one is probable case. He also has a contact, he or she. There are symptoms, the test is negative, not done. This is not isolation. This is quarantine because they are only a probable case. And then the suspect case is a person who is having the contact for COVID contact is positive, and then the symptoms are not there, either negative or not done test, and then quarantine and test these people. Okay, just a sec, I will see that the internet connection appears to be little shaky. I will open the door so that the connectivity will become better. The three types of cases: definite case, probable case, and suspect case. Remember these things and the actions to be taken also, you remember. Okay, what is the protocol like? Can I do a RT-PCR directly? Yes, do it, and positive or negative is done. Or if you do a rapid test, it can throw a positive result or a negative result. If the RT-PCR is positive, no need to do, RT-PCR is not required if the RAT test or the rapid test is positive. If the rapid test is positive or the simple test with CART test in 15 minutes, there is no need of this RT-PCR. If it is negative, asymptomatic, declare as a negative. If it is negative and symptomatic, of course, do an RT-PCR. What is POC? Point of care test, 15 minutes to 30 minutes. This is called RAT or the rapid antigen test. Okay, how do I try is, and somebody is tested positive either with the RAT test or with the complete RT-PCR, then eligibility for home treatment should be ascertained. Most of the people will be eligible. What is the eligibility? They don't have severe symptoms, they are not breathless, and the SpO2, I'll show you what is the SpO2 measurement, is more than 94, and the respiratory rate is less than 24, and then there is no breathlessness, and fever is also less than 100 and 101 continuously. And such patients can be managed at home. So if somebody is having severe disease, then they have to go, whether they get admitted into an oxygen center or a ventilation center, depends on the severity. So simple thing is the home isolation or the COVID care center. Second one is moderate disease, DCHC, and DCHC is dedicated COVID health center, and DCH means dedicated COVID hospital. Hospital means what? Which have with oxygen and other facilities. Okay, these are certain gadgets which you can keep in the community. If you are in an apartment community, try and create a room wherein you have an oximeter and you have a thermometer, IR thermometer, and you have certain sugar testing facility, blood pressure, and this is oxygen concentrator. What is oxygen concentrator? It is a device which takes the room. This is a little bit oximeter, and there are several brands. Try and buy a good brand, and this oximeter will tell you the oxygen concentration. What do? We have to not talking like this. We have to be at rest for 5 minutes. Then put it on, and then once it is on the oximeter, I plug it onto my one of the middle finger or this one. Keep it at the level of the heart like this. Okay. Then after the beeps, you can see the reading. 98 and 97. Okay. Now the first reading and bigger thing is the SpO2. Now the other one is the pulse rate. Since I am talking and to you, the heart rate is slightly on the higher side. Otherwise, it will be around 80 for all of you. Okay. SpO2 of more than 94 is safe. SpO2 less than 94, you have to start alerting yourself. SpO2 less than 94, and you start, this is alarm sign. Or respiratory rate more than 24. How do I count that? put the hand on my chest or lower chest or abdomen, and like this, and then each time I breathe, my hand goes up, and that is counted. One is counted, then two, like that in a minute, how many times I am respiring. Not actively ask him to breathe. Just let the patient breathe at his own, this one. He will be in the lying position, put the hand on the upper abdomen and see the lift. And if that rate is more than 24, we are in for danger. More than 30, very severe disease. And this will be less than 85 in severe disease. So, I am giving you the readings here. 94 or more is moderate disease. Less than 94 to 85 is, sorry, 94 plus is mild disease. So 94 to 85 is moderate disease. Less than 85 is severe disease. This is in terms of the, we are in the oximetry. This oximeter reading, I told you how to do it. 94 and above is mild disease, no need hospitalization. 94 to 85 is moderate disease, and less than 85 is severe disease. Likewise, respiratory rate. I showed you how to count the respiratory rate. Like this, each lift is one respiration. In 1 minute, how many times it is happening? Less than 24, normal. More than 24, moderate disease. And more than 30, severe disease. Blood pressure and pulse rate also should be measured. Temperature of more than 101 continuously is not a good sign. So you now learned what are the mild signs and what are the moderate signs. So what are the things? Cough, dry cough, and then fever, cold, sore throat, throat pain, loss of smell, very specific, smell and taste, weakness and diarrhea. Okay, breathlessness, I told you how to test for breathlessness. Count 1 to 20 without taking breath, or ask him to recite a small passage around 2 3 lines. And sensorium testing is ask him what he took in the morning and what is the date and time. And orientation important. Or ask him to do a simple math, 16 divided by 4. What something like that you ask. Then they will be able to say. And severe exhaustion also can be combined. And here we require to know the serious signs to go for admission or look for oxygen bed. What are they? Breathlessness, as I told you. Second thing is 101 above fever continuously, not one reading. And then SpO2 less than 94, and then this respiratory rate which is more than 24. And these are the things, and of course altered sensorium and exhaustion are also added features. Watch out for these things. This will happen only in 5% out of the 100. Not everybody will get moderate and severe disease. Don't be worried. Most of you will get like this, and then you will recover. Okay. Now what do I do? Record temperature, respiratory rate, oxygen saturation. How frequently? Minimum 3 times, maybe 4 times. Take paracetamol, dolo 2 or 3 times or even 4 times. Vitamin C. Take a COVID test. Follow the treatment guide. Do you have any other illnesses you have to inform? Suppose diabetes or other diseases. Test report awaited. What I do? Ask the person to isolate in a separate room, wear a medical mask, and use disposables, monitor symptoms thrice a day. Better in this case because pandemic is very rapid. So better they use a N95 mask. Somebody is symptomatic and given a test, use an N95 mask. Okay. And then test positive, of course, they have to use N95 mask and monitor themselves. Okay, all contacts and family members must be tested. All contacts and family members must be tested. And don't go for repeat testing. Today I have tested, it is curing or not after 5 days, whether increasing, decreasing, you cannot know that. The other thing is don't test whether you are totally cured after 14 days. There are no test kits at all in the country and we are constrained. Government of India actively discourages a second test during the illness or at the end of the illness. Don't go for that. One single test is good enough. Your symptoms and your CT scan can be your guide. These are the host of diseases which can complicate the illness like high BP, obesity, lung disease, heart disease, diabetes, cancer, chronic renal disease, some immunocompromised condition, liver disease, advancing age. These are all the problems. But then, all of us will not have it. Only the selected persons, if it is there, naturally you will be alert with those people, and suspicion should be higher in them for escalation of symptoms. So what happened? Now I had a little cough-like thing. Immediately I used my elbow. That is the way you have to also do. So rare and complicated COVID is the pneumonia, COVID pneumonia. This is because of the cytokine storm, we say, and there are certain conditions like COVID pneumonia, cytokine storm, acute respiratory failure, ARDS, and blood clotting occurring in the blood vessels, and shock and septic shock and heart problems can come. But that is too much for this audience. So I would not go into that, but there are good medicines today, like early use of steroids, blood thinners, in cases required antibiotics, not routinely, and then the emergency use drugs like remdesivir and other things can be used by the doctors. Don't go and buy themselves for yourself and use. This is not for non-medical persons. Okay, another thing, important thing you need to know, common flu, the transmission case fatality is so low and the hospitalization also is low and the RO number is 1.3. Whereas COVID-19, the RO number is quite higher. Fatality can be around India, we are experiencing around 1 to 1.5% fatality. In other countries up to 2.5. It is good that our fatality is lower, but then we have to be very careful to see that one doesn't get into that one. Okay, general guidelines for COVID, this one, if you do not invite Corona will not come. If you don't invite, you won't catch. Do not read, review negative news. Do not depend on WhatsApp. Do not forward COVID messages and jokes. COVID jokes are, COVID is no joking matter. Check information from authentic sources which I have listed. Recovery is the rule for many, 95% is the recovery rate. Don't think too much of severe illness, what will happen, whether I will die or something like that. Those things are not going to help you in recovery. A strong mind is very important in case of bad health or high risk health. Robust health insurance, all of you have, in case one gets admitted. Have some financial planning now itself. We never know when one has to leave the world and make some planning possible. Not that doesn't mean everybody will die. So these are the common things. So paracetamol, vitamin C, and then keep some oral fluids, pulse oximeter, oxygen concentrator, infrared thermometer, BP, some gloves, PPE kits, sanitizer, liquid soap, three-ply mask, tissue paper, disposables, covered bin, N95 masks also. This is to set up a small isolation room in your small premises, a cluster of 10 houses, 100 houses, or an apartment complex. You can create a COVID facility, isolation facility, and it will help others to also not get the disease. Breathing exercises are a must. I'll demonstrate. Kindly see that. I sit quiet like this, and then with the arms rested on my thighs. And what I will do, I'll close my eyes and take deep breath. For 8 counts, I hold the breath and then fully exhale. Again, I am doing, take deep breath, hold for pursue your lips and blow the entire air through the mouth. While inhaling through the nose, while exhaling with the round lips, tube-like lips, and slowly exhale fully. This is called a pranayama in different things, art of living, you are familiar, but whatever it is, inhalation, breath holding, and exhalation is the best way to improve your lung power. Prone position, that is, sleeping on the face down, with the head tilted to one side, and then at least 2 hours in a day, patient has to sleep in the if possible more, in the prone position. Out of 8 hours, 1/4 of the sleeping time in the prone position, remaining left side or right side, you can sleep and not very flat, because by sleeping flat, lungs will not get oxygen and tongue also will be falling backward. Normally, lower part of the lungs are not well aerated unless we try. Where only half of the lung is aerated, and each time I sit relaxedly also, sit like a king or a queen, and then use the backrest and keep taking deep breath like that, and don't be crouching like that like a sort of crumpled person, and don't breathe like that. Shallow breathing is no use. Have the lungs full air inside. Need to do regular breathing exercises. Already I have shown you, no video is required, and download those apps, government apps. Can people wear masks outside while exercising? Generally not recommended, because exercising and mask don't go well. But if you are walking, you have to wear a mask. But if you are doing rigorous exercise in an open garden, then probably you have to not wear a mask, and that is not advised now, because going outside without a mask is very dangerous. And then chappals and all they don't bring in. Don't try to keep on cleaning your chappals unnecessary, waste of time. And then use indoor one pair of chappals, outdoor another pair. And then COVID is caused by not bacteria. Many people would have read several messages. Italy has now done a resection. This after the 100 patient, dead patient. They found it is bacteria. All humbug and useless message. We know enough evidence is there to show that this is a virus which is causing all that. Most people will get COVID and recover from it. That is true. Most people will recover. 95% will recover. Drinking alcohol prevents COVID. No. It in fact harms. Smoking and alcohol are two things which are very dangerous during COVID time. There is currently no drug licensed for COVID. Only emergency use authorization. There is no antiviral agent. Do not use Flaviflu or something which you people, Flavipiravir, if you are using, is not useful. If some doctor prescribes, I don't want to sort of contradict, but then it is not useful. Remdesivir is only drug, and this is not a magic bullet. Remdesivir is not a magic bullet. It can only reduce the viral multiplication. Used only between the 6th to the 12th day, and not in the first week, that too in the hospital setting, that too when the oxygen saturation is going down. Conditions: patient should be in the hospital under supervision. Number two, the oxygen saturation should be low. And number three, he is on oxygenation and he is receiving the other support treatment. Add remedies for 5 days may be helpful. Not a magic bullet. Don't worry about it. And then, some people say, oh, okay, I'll sit in the sun. It sterilizes my body. Don't do that. Sunlight cannot sterilize the inside virus. Okay, being able to hold my breath. This lady says, I'm able to hold it for 5 seconds. No, I'm healthy. No, that is not a good test at all. The best test is do the SpO2. The oximetry is the best test. And then, UV lamp kills this. Don't depend on these advertisements that UV light kills the corona and all that. They're all humbug. Best thing is they are inside sunlight and also your air also inside. And then does new coronavirus affect older people? Certainly yes, older are affected. In the second wave, younger people are also being affected. There are several antivirals which are being tried, several experimental medicines. Hydroxychloroquine is ruled out, interferon to some extent it is not directly available now. Flavipiravir is not useful. Plasma in selected cases, yes. Remdesivir say, as I told you, the indications. Others are only experimental drugs. They are very powerful drugs also like this group, but only in a very selected group of patients. The treating doctors will decide. You don't have to worry about those names and how to use and all that. Okay, what is the hope? How to cope with this pandemic with hope? 1, indoor play. 2, relaxation exercises. 3, yoga or meditation. 4, aerobic exercises, stretching and doing all simple things. Walking is the best exercise. Prayer gives quality of purity to the mind and also quality time of relaxation. And then creative activities, positive thinking, installation of hope, reading good books, and also listening to music. Online learning courses are there, or any webinars like this to educate yourself. You use that opportunity. This is the best way. Lessons learned from the COVID. Number one, COVID is 95% of the time It is normal illness. It will come. You will come back to normal. Number two, observe yourself whether you got qualified for oxygen and admission. That is the moderate and severe disease. Number three, do not panic if the oxygen is dropping, and home oxygen also can be used. Number four, wonderful treatment is available for bringing you back, like high quality steroids and then blood thinners and all. And ultimately, where ventilation and other things are reserved for only a select few and not for everyone. We don't have enough ventilators, neither we all of us require ventilators. Okay, many positives. Home is the safest place. You can be productive from home. So COVID doesn't discriminate rich, poor, and any divide, any religion, caste, kind, and creed. All can live without luxuries. We have lived for 1 year. Postpone all luxurious travels, items, and avoid wasteful travel. No travel by any mode for whatsoever for the next 1 2 months. And then use a civilized behavior. And we have less pollution when we are indoor. When we go out, all automobile pollution. These are the various lessons that we have learned from COVID. And finally, stay safe, stay healthy, stay at home. And there are several people, the doctors, nurses, paramedics, ambulance drivers, policemen, supply chain, the pharmacy people, all of them are working round the clock in with stressed minds and stressed bodies. Give our support to them. See that we lessen the load on them. How do I do that? By not becoming another case and adding to the pool of 4 lakhs per day. So today India is registering something around 4 lakhs per day. If you bring it to around 40,000 or then to 10,000, then the battle is mostly won. So because that reduces the demand by 10% here, and by the from 100% it has come to 10%, then it has come to 2.5% here. So all the healthcare will be available for us, and then they can concentrate on vaccination and then speed up. Now vaccination is slower because hospitals are busy treating the patients. And if possible, try go to a place where COVID is not being treated for vaccination. Vaccination centers, better to choose a center which is not non-COVID hospital. Another thing is important news for all of you. It won't be like this forever. Even this will change. Even the best moments have changed, the worst moments also have changed. Remember and have faith. Three types of faith. What are they? Faith in yourself that you will recover and you will be healthy. Faith in the treating physician and the team, and faith in the Almighty. The faith in yourself, faith in the treatment and the treating physician and the group of people who are helping you, and faith in the Almighty. But whoever is there, is your God. God is only one. We call him by many names. So keep these three things together, and the Saptapadi are the 7 steps for COVID. If you don't catch me, I will not catch you. That is what the Corona says. Don't run after it and bring it. Go to a function, go to a marriage, go to a mall, and then catch it and bring it. If you are inevitable that you have to go to work or something, then protect yourself thoroughly and do that, and change your clothing and sanitize yourself. The mantra is test, trace, treat, and empower. That is what this session arranged by Vamsi and the group of Art of Living. We are empowering you how to take good nourishment, how to take good breath, what is breathing exercise, what is oximetry, what is mild disease, what is moderate disease. All this is empowering you. The empowering means not confusing you. Don't too much dig into it was 95 yesterday, today it is 94, I am going down, not like that. Anything above 94% SpO2 is good enough. So recovery is the rule and danger is only an exception. Panic and fear are not at all prudent. Avoid negative charts, negative behavior. Don't converse over phone. No, I know that man died. I know this hospital did not have beds. This hospital no ventilator. There no oxygen. Remdesivir is not given. All this is useless. What is it going to do? This is not your prerogative. Somebody dies, how can you go and save him? It is for the doctors and people who are working round the clock. They will do it. Don't avoid all chat and negative news. Be prepared for the worst scenario. Acting right is a civilized responsibility. Stay home, stay safe, stay healthy, and be socially responsible. All of us together only can win. We are responsible citizens, educated persons. We have to educate the uneducated persons also. Believe me, even this will change. Prayer, faith on the Almighty, and the three types of faith are the watchword. With these things, I'm going to end this session. Namaste to all of you. Thanks for the opportunity given by the Art of Living Foundation and Vamsi Garu for coordinating today evening's talk. And I am now open for any discussion from the chat box.